Hi, this is Patti, and I'm joined for today's podcast by Dr. Heather Woolery-Lloyd, and we're going to be talking about a subject that's of great interest, and that is the treatment of textured hair. We're excited to drop this episode during Black History Month because we're going to be talking about some interesting pieces of Black history. Heather, tell them what we're going to be speaking about.
So this episode will talk about so many interesting things, lots of great pearls. We'll talk about the first female millionaire in the United States who actually developed a process to straighten Black hair. And we'll talk about different types of hairstyles, how dermatologists can be better informed when it comes to managing textured hair. And we'll talk about some of the newest research that has been published looking at hairstyling practices and cancers like uterine cancer and breast cancer.
I love that, and we hope you all will join. This is going to be an episode you don't want to miss. Hi, I'm Dr. Patti Farris. I'm a board-certified dermatologist, and I'm your host for this episode of the Science of Skin podcast. I am very excited today to welcome a good friend, a colleague who I have tremendous respect for, Dr. Heather Woolery-Lloyd. Your name is always a tongue twister for me.
It is a tongue twister for everyone.
Tongue twister.
It is.
Good. That makes me feel better.
And my full name has 26 letters.
I always stumble over it and I pronounce it wrong most of the time. So I apologize, but I've known you for such a long time. I should have that down at this point. No excuses. Anyway, I'm going to read Heather's bio. She's the director of the Skin and Color Division at the University of Miami Miller School of Medicine and founder of Derm Friends, which is a really innovative platform that is a newsletter that's focused on skincare education. With a career spanning over 2 decades, that's hard for me to believe, she has authored over 70 peer-reviewed papers, and she lectures internationally. She's an active member of the Skin and Color Society, as well as the American Academy of Dermatology, and she was honored with the AAD's Presidential Citation for her commitment to education and research in dermatology. That's so well deserved. I also want to add my own little footnote to your bio. She has one of the best social media presence, in my opinion, of all of the derm influencers. And Heather, you're one of the people that I go to because I learn a lot from your posts. So thank you for that. I really love your social media feed.
I'm honored to hear that. I really am. And I love creating content online. So that makes me really happy.
I know you do. And you do such a good job at it. You do your homework, which is what I love. So we're going to talk about a subject that I think a lot of our listeners don't know a lot about. And that is the sort of hair care routine, rituals, and products that surround our patients who have textured hair. It's a subject that I realized, Heather, when you spoke at our meeting 2 years ago, I knew nothing about. And I was thinking to myself, all these years I've been treating a lot of patients with textured hair. And I probably said a lot of things that really didn't make sense to them and clearly signaled that I knew little about what it really means to have textured hair. So I think that this is going to be a podcast episode that so many of our derm colleagues, as well as anybody who's listening, is going to learn a ton about. So I can't thank you enough for sharing your expertise on this subject with us.
Well, thank you for having me. This is one of the topics that I love to talk about. And it is an area that we all can learn. Even I have been talking about this topic for years, and I'm always learning something new. So I think it's a relevant topic, and I think the listeners will really enjoy learning about this, about textured hair.
For sure. So I want you to start with a fascinating story that you told on podium in our meeting about the first woman who really successfully marketed hair care for Black women. And her name, as I remember right, is Madam C.J. Walker. And I found this story so fascinating. I want you to tell it to our listeners.
So it is an absolutely fascinating story. So Madam C.J. Walker basically marketed a steel hot comb to straighten hair. And in marketing this product, she became what is considered by most people the first self-made woman millionaire in the United States. So I always say hair is really important, right? You can become a millionaire by marketing hair.
Just with the hot comb, right?
Right, with the hot comb. And I think that she's really special and unique. She was actually the first child in her family born into freedom. Both of her parents were enslaved people. And she had, a lot of struggles. She was orphaned at a young age, and then got married very young and widowed very young. And it was very much a self-made woman. I think for dermatologists, what's really interesting is she's one of the first people, considered to be one of the first people who utilized before and afters in her marketing, which of course is a huge part of what we do. And again, it doesn't surprise me that she was the first self-made female millionaire in the US. So really just by marketing a system to straighten hair is how she gained her success. And she ended up in the end of her life being very philanthropic, and was just overall an outstanding woman and entrepreneur. So I love to mention her in my talks because she is so unique.
It's such a great story. So let's start with physiology. What are the physiologic differences between textured hair and straighter forms of hair?
So first of all, when we talk about textured hair, it's important for us to know that I'm going to be talking about ethnicities, right? So I might say Asian, Caucasian, and African hair. But as we know, we live in this multicultural world. So it's very possible for someone of African descent to have straight hair, someone of Asian descent to have curly hair. A lot of people of Asian descent have curly hair, but these are just general categories. So I always want to set that baseline that I'm going to say Asian, Caucasian, and African hair, but know that we really do live in this multicultural world. So there's huge variations within different ethnicities. But in general, Asian hair is large and round. So it's perfectly round, has the largest cross-sectional area. And this data comes from studies that were done years ago, using high-powered microscopes to examine the hair. So the hair was large, round, had the largest cross-sectional area, and in general was very smooth, didn't tend to have breakage or what they call longitudinal fissures, which are cracks in the hair. Then when we think about Caucasian hair, that's a little more elliptical, a little bit not as round, a little bit, I think of it as oval shaped. Can have occasional spontaneous knots, because in this study, they would have people just brush their hair and submit the hair, and then they would examine the hair and see if the hairs had fissures or had knots or had frayed ends. They were just looking at natural untreated hair. So Caucasian hair is, as I said, more elliptical and can spontaneously knot. And then in the African subjects who they examined, those subjects' hair, that hair is most flat. It's almost ribbon-like. So think of it as a coiled ribbon. So it's a very flat ribbon-like hair. That hair in those studies was much more likely to have longitudinal fissures and frayed ends versus a cut end or a natural tip end. As far as keratin, the keratin composition in the hairs are very similar, but there are some differences when it comes to how strong the hair is. So in these studies, African hair has decreased tensile strength, so it breaks more easily when it's stretched. And also studies suggest that people of African descent might have less hair density and less fibers attaching the hair to the scalp. Or less elastic fibers attaching the hair to the scalp. So what that means from a big picture for a dermatologist is the hair is much more fragile, easier to break, and theoretically it has a greater predisposition to many of the hair disorders that we see.
That makes total sense. And that's why we see so many
women
with textured hairs in our office complaining about my hair's breaking off. And then there's all the processes, and we'll talk about that. But let's start with sort of basic hair care, washing, conditioning. I know this is so important when you have ethnic hair, and it's so dramatically different to the way that I might take care of my hair, which is wash and blow dry every day and run a little conditioner through the ends. It's a totally different process, and it's a time-consuming process.
Yes. So basically, the wonderful thing about coily, kinky, curly, textured hair is that there are so many different ways to style. So it's very hard to make generalizations, but I'll give basic categories of how women might style their hair. So first of all, as we know, their natural hairs are keeping the natural hair's texture is very, very popular right now. So someone with natural hair who doesn't have any chemical in their hair whatsoever may wash their hair every 1 to 2 weeks, may use a lot of conditioners and oils to help manage the hair, because the hair could feel very dry. That, remember, in straight hair, the oils that are produced from our scalp naturally kind of travel along that hair follicle down. And so the hair can get oily very quickly. The reason why women with textured hair don't need to wash their hair as frequently is because their hair never really feels oily. I never understood the concept of oily hair. I had to learn that concept because my hair was always dry. Like if I didn't wash my hair for weeks, it didn't matter. It was always dry. So a lot of women with textured hair add oil to the hair, add conditioning products to the hair to improve manageability and to improve, like, even brushing, the ability to brush the hair when the hair, if your hair is curly and you brush your hair. So, and certain hair types you don't, like afros, for example, after you style it, you don't brush it because then it would just, lose its shape. So for people who have no chemical in their hair, the typical hair care practice would be to wash every 1 to 2 weeks and to use oils or conditioners or leave-in conditioners to improve manageability of the hair. And then that hairstyle could also be braided. It could, if the person wanted to maybe add extensions, they might braid the hair and sew in extensions. They might braid the hair and glue in extensions. That one I don't like, no glue at all, because glue is a common cause of contact dermatitis, because some of the hair glues either have acrylates or they have rubber or they have latex. And so they tend to cause allergies in a lot of our patients. So glue is a no-no. And then there's braided and extensions or cornrowing. So that is for people who have natural hair. Then there are many different processes used to straighten the hair. So there's chemical relaxers, that's sodium hydroxide or lye, that works by breaking the disulfide bonds. And then that type of person, if their hair is chemically straightened, might do a wash and blow dry every 1 to 2 weeks, or a wash and set where they put their hair in rollers and sit under the dryer, because the goal for that person is to have straight hair. And then, and the different types of chemical relaxers to straighten the hair are, like I said, sodium hydroxide, but also keratin, which is very popular for people with coily hair because they report that their hair looks smoother and there's less frizz. Most keratin products, though, have formaldehyde, and formaldehyde is a carcinogen and is very much regulated by the FDA. So you've probably heard that term Brazilian blowout. That was a popular hair straightening process that women were doing that used high percentages of formaldehyde to straighten the hair. And the women who did it used to wear literally gas masks. And the patient of the client who's getting her hair done was wearing a gas mask. They would do it in front of a window with the fans blowing, because formaldehyde is toxic, as we all know.
Toxic, yes.
Who all of us who did gross anatomy in medical school. And how
well we remember, right?
Yeah, you can't forget that smell. I still can't eat in the restaurant that I used to eat in when I was a first year medical student, because I have that smell of formaldehyde. So Brazilian blowouts are very dangerous. The original ones, where you needed to wear a gas mask.
Do they still do those, Heather? Or
they still do. I have seen people I know personally, on Instagram getting their hair done with a mask on their face, which I think is crazy. So I tell my patients, if you can smell the formaldehyde, it has formaldehyde, even if it says it doesn't. The FDA is trying to crack down on this, but the formaldehyde is what straightens the hair. So correct. I think it's the ingredient that's the magic ingredient. So there's keratin, and then of course there's just straightening with flat iron and oils and so forth. So it's important to note that I talked about Madam C.J. Walker, and she used that hot comb to comb through and straighten the hair with a heated comb. Nowadays, people are much more likely to just use a flat iron to straighten the hair.
Okay.
So, but in general, the big take home is washing and conditioning is every 1 to 2 weeks. It is not every day, because these processes take so much time. On average, it takes hours to get your hair done if you have curly textured hair and you're doing a style that requires some styling. Now, obviously, if someone has a short afro, of course they can wash their hair every day, every other day. But most women, if they have some sort of elaborate style, it is a very long process, and they're not likely to do, if you say wash your hair every day with this dandruff shampoo, they're not likely to do that. So once a
No.
week is what I recommend for my patients.
I've made that mistake of telling patients with bad sebderm, well, just wash every other day. And they just look at you like, are you crazy?
Are you crazy? That would be, that's 3 hours of my
Yeah, I
life.
was going to say, do you think I have that kind of time?
Exactly.
That was when I was super naive, but yeah, I understand that. Talk for a minute about the things that you see from over processing, because I know that that's a huge problem in this patient population
Yes.
with textured
Yes.
hair.
So what can happen is if there's many different ways of overprocessing. So there's actual heat damage. So even if you don't have any chemicals in your hair, when you repeatedly straighten the hair with high heat, that can damage that hair follicle, the hair cuticle, and you can have, breakage, which is a very common complaint. So heat alone can be a source of overprocessing.
Right.
Sometimes people think only chemicals can cause overprocessing, but heat can also cause overprocessing.
Don't you get bubble hair when you heat your hair
bubble
too much?
hair with
Bubble
that
hair.
heat. Yeah, exactly. And then when we talk about the chemicals, obviously the chemical relaxers for people who are doing these straightening processes should only be applied to the roots, the fresh growth that is unprocessed hair. But inevitably, the relaxer does overlap with the already straightened hair. And if the relaxer is done too frequently, or the hair straightening process is done too frequently, or left on for too long, or there's so many different variables that can happen, you can basically degrade the integrity of the hair, and then you see more breakage. So it is really, from a patient perspective and a recommendation perspective, I tell my patients, find the right hairstylist, because that can make or break you.
That. How do you find the right person who's really knowledgeable on using these chemicals and these treatments?
Well, interestingly, there is a network. It's called the Strand Network, and it's a network that women or men who are stylists who really want to understand hair health can come and be trained by dermatologists. And so if you can find, a stylist who's in the Strand Network, that would be great, because you will know at least those stylists have a real interest in understanding hair health. But other than that, I think it's a little bit intuitive. Like once you find someone who's good, you just don't leave that person.
Them for life.
So it's like any other hairstylist. Once you find someone who's good, you just can't leave. And if one of my favorite quotes is from Dr. Dulova. She's a dermatologist in South Africa who's the leading dermatologist in hair. And she says, if it hurts, if the hairstyle causes pain, then it's not a good thing. If the braids are too tight, or you have any pain, that is a signal that, if you have to take a Tylenol when you get home from getting your hair done.
Oh my gosh. I mean, I guess they could be that painful if they're doing the treatments wrong. Yeah, it can be painful.
If braids are done too tightly, extensions are done too tightly. If you put on some type of glued-in product and all of a sudden your scalp is itching and burning, So in general, it's pretty much intuitive. You can tell when someone is good. Unfortunately, you have to go through a couple bad ones to find the good ones.
The good ones. I kind of wonder about putting the extensions on hair that's already so prone to fragility.
So you bring up a good point. So they've done studies on this. So as far as traction alopecia is concerned, applying if the hair is in its natural state and it's not straightened, so it's natural virgin hair growing out, then that is obviously the strongest, most robust hair. And the rate of traction alopecia increases when the braids are done on chemically processed hair. So you brought up a very good point. We absolutely do not recommend that you do braids or extensions or any type of manipulative process if your hair is chemically straightened, because then the risk of traction alopecia goes up 3, 4, or 5 times more. So on natural virgin hair, it shouldn't be a problem if the person isn't braiding too tight. But if the person, even if they're not braiding too tightly, if your hair is chemically straightened and you do extensions or braids, you significantly increase your risk of traction alopecia.
That makes total sense. Oh my goodness. We see so many patients in our practices who have traction that started when they were children,
Yes, tight hair.
especially all of this around the front.
Yes.
And is there any advances that might help those patients? And can they be transplanted?
Well, what I would say with traction, obviously prevention is key, like everything in
Right.
medicine, but this is one of the diseases where if a mom comes in and I notice that her daughter's hairstyle is a
Yeah.
little bit tight, or anyone, if it's mom or adult, every time I'm seeing my patient for something else, but I notice really tight braids, I'll say in a very, and it's a little bit touchy to comment
Sure.
on people's hair, but what I say is, I'll say, oh, your hair looks a little tight. You have to be careful because you can lose your edges. And so, and sometimes patients will say to me, oh, it doesn't feel tight. It really doesn't feel tight. And sometimes we'll say, oh, yeah, it was very, very tight. I couldn't sleep for 2 days. And I say, don't go back to that stylist, or, don't, or tell her to do it looser because you will eventually lose your edges. So you can volunteer in a very culturally appropriate way. But the way I say it is it looks a little tight, kind of, very gentle.
Trying
And
to soft
you
pedal
can,
it.
yeah. And, you have to be careful because long-term you can lose your edges. And the key is prevention. When it comes to what's new, obviously we have so many things in the hair space. It's a lot of new things that are coming out. But traction is tough because long-standing traction becomes permanent. So for my patients who I catch it early, I'll do topical minoxidil. I might recommend a hair supplement because I think that can just improve the overall hair health. They could do red light therapy. They could do PRP. That's becoming very popular in that population. And then long-term, if it's long-standing traction, there are hair transplants that are very, very successful, very successful.
Mm-hmm.
But obviously we want to avoid the patient getting to that point.
Yeah, of course. Where are we at with CCCA?
CCCA is interesting. I love that there's always new research coming out in that area. A lot of the new research in CCCA is more basic science. So some data that has been published in the last several years shows or suggests that it's autosomal dominant. There's some data looking at the key genes that are involved and so forth. When it comes to treatment, although we have lots of treatments, I still think it is a little bit of a challenge in, your dermatology practice. That being said, patients can regrow hair. So one big take home is whenever a dermatologist sees someone with CCCA, don't say it'll never grow back, because if it's in the early stages, it absolutely can grow back. And I tell my patients around 10 to 30% regrowth, and sometimes even more than that. So I don't want you to set unrealistic expectations, but I don't like when patients say, I was told it will never grow back, because what I personally use, I use a lot of topical steroids, a lot of intralesional steroids. Right. You can use, there's some newer treatments like topical metformin was reported.
Right, I saw that.
Obviously, we can use minoxidil. There are a lot of new treatments that are coming out, and we do see regrowth. We don't want to say, 100% of your hair will grow back and it'll come back to normal, but don't say there's no treatment all hope and send them away. And the other thing, another key clinical pearl, breakage on the crown of the scalp is early CCCA in these patients. So if a patient says they have this good hair density, but they say they're having breakage, pay attention to that patient, because that early intervention can stop this process completely with a topical steroid or an anti-inflammatory.
That's a great pearl.
Yes.
That's a great pearl. Yeah, it's a very challenging condition for sure. Let's talk for a second about products, because we kind of went through that quickly. Are there certain things in, for example, shampoos or that you may want to avoid or that are more important in textured hair?
I would say in general, from a shampoo standpoint, I always tell my patients that your choice of a shampoo and conditioner is a very personal decision. And I can recommend products that I like, but if you don't like it, and it doesn't work for your hairstyle, then it doesn't really matter. So I'd say in general, for shampoos and conditioners, people with textured hair prefer products that don't have harsh surfactants that are going to strip the hair. So the old-fashioned shampoos that, or if it says volumizing, that means it probably is stripping a lot of the oils off of the scalp. So those patients are going to be interested in conditioning shampoos, hydrating shampoos, gentle shampoos, gentle surfactants. Those types of patients are going to be interested in heavier conditioners that have more, that offer more hydration, but also moisturization and oils to help manage the hair. So as I mentioned, in general, people with curly, kinky, coily hair, their number one complaint is that their hair is dry.
Too dry.
And so they're going to look for products that are focused on replenishing dry hair, and I'm going to avoid products that are very harsh and are designed for oily hair. So I can just give general recommendations, but there's no one brand or the other. It really is a personal choice.
And you'll look at the labeling and see which ones say they're, deeply hydrating or
exactly
gentle. That's good advice. So what really started me thinking about interviewing you on the subject were the new studies that are coming out now, talking about the relationship between some of these hair treatments that we talked about and cancer in women with textured hair. And I think they were somewhat sensational, some of the things that came across our feeds, but when I was reading them, I became very concerned. So I thought you would be a great person to talk about these studies and, kind of give us the tea on what really is the level of danger here.
So these studies are very interesting, but it's really important to understand the kind of background of the study. So most of the data comes out of a study called the sister study. So it's a group of over 30,000 individuals whose sister had breast cancer. So they didn't have a history of breast cancer, but their sister had a history of breast cancer. So they studied these women and they asked them about many different things, but one of the things that they asked them about were their hairstyling practices. So two big headlines came out. One of them was talked about uterine cancer. And it was talking about the use of, it said, hair straightening products. But so when those headlines came out, they would say relaxers associated with increased use of uterine cancer. But what did the study actually ask? So the question they actually asked is, in the last 12 months, have you used a hair straightening product, including a flat iron to straighten your hair, the keratin products that we talked about, which contain formaldehyde, or chemical relaxers, which contain sodium hydroxide or hydroxides in general. And in that group of people who said, yes, in the last 12 months, I straightened my hair, essentially. And they asked them about frequency. So the people who said they had straightened their hair at least 4 times in the last 12 months were more likely, I think I have some notes here, but I think they were twice as likely to develop uterine cancer than people who had never straightened their hair. So that's what that study looked at. It was a little over 33,000 women. Their sisters had a history of cancer, and they were asked if they had used hair straightening products in the last year. Now, obviously, when you know the big picture where they looked at flat irons, keratin, and relaxers, that kind of is a different population of people than saying chemical relaxers.
Yeah, it's not a great study design, really.
Yes, they just are women who have straightened their hair, basically, and they had a higher risk. So we do know for a fact, obviously, formaldehyde is a carcinogen. So the keratin is the Brazilian blowout and the products that have formaldehyde in them are actually regulated by the FDA because formaldehyde is a known carcinogen.
Correct.
But sodium hydroxide is not a known carcinogen. It's an ingredient found in a lot of products, and that's the primary ingredient in chemical relaxers. And obviously, flat ironing the hair, I can't think of a way that flat ironing the hair could be associated, unless the product that you put in the hair to flat iron the hair could be associated with cancers. So it's a complicated study. When you know that background, it's a little bit more confusing. Also, in the study of these people who frequently straightened their hair, 60% of them were Black, 40% of them were white. So it wasn't just Black women had higher rates of, it was that all of the women who frequently straightened their hair had higher rates of uterine cancer compared to the women who didn't. What can you make of that? The only thing I can think of is that maybe people who straighten their hair use more personal care products in general, that may have hormone disruptors. I don't know. But the headline, relaxers in Black women causes uterine cancer, is really not the conclusion once you understand the background of the study.
Yeah, and only 60% of the patients were patients with skin of color. Is that what
Yes,
you're
it
saying?
was 60% were Black.
Wow.
So I think that the big take home for us, and there was a similar study that looked at breast cancer, and it looked at hair color, hair dye use, and they found that permanent hair color, not rinses, which, basically rinse out, or semi-permanent, but permanent hair color was associated with higher rates of breast cancer. So it's interesting, but you kind of have to understand the background of these studies, and definitely the one that has to do with hair straightening. It's important to know that it included any type of hair straightening. So it makes the results a little confusing. The reason why these studies can be a little bit at least the headlines can be harmful, not the study, but the headlines, is that it kind of puts the blame on Black women, like, oh, you're straightening your hair and that's why there's an increased rate of uterine cancer in Black women. And the interesting thing, it gets even more interesting. There's two types of uterine cancer. Type 1 is the one that's associated with hormones, that's hormone sensitive, and type 2 is not hormone sensitive. And the increase in uterine cancer overall that we're seeing in Black women, because there are higher rates of uterine cancer in Black women, is the type 2 type of uterine cancer. So
it's not hormonal.
At this time, so some of the studies suggest that. So, and in general, women are using chemical relaxers less because, as I mentioned earlier, it's very, very popular to have natural hair. So I think the study is a little bit confusing and those headlines are a little misleading. It's great research. I'm not saying it's not great research, but it's something that you really need to understand the study design in order to interpret those results.
That's a great summary of all of that, because I was very concerned when I saw those headlines. I was like, oh no, because I was familiar with the uterine cancer study. Very interesting. Well, I want to just thank you for sharing all of your knowledge and your expertise on this subject. I know our listeners will love this episode. Again, it's something that many dermatologists don't know much about. And so I think you've really enlightened us about hair care products and the rituals that go along with having textured hair, and then also teasing out some of this interesting data that I think so many of us were concerned with. For those of you who are listening, I want to thank you for joining us for this episode of the Science of Skin podcast. And if you like our podcast, please subscribe, give us a review. We'd be most grateful. And Heather, I look forward to seeing you at the Science of Skin Summit this year, because you're always front and center and somebody that we can depend on. And we're so grateful again for your attendance there as well.
I'm looking forward to it. As you know, one of my favorite meetings of the year. So you'll see me front and center as usual.
Can't wait.
Taking notes. Taking
notes. Me too. We learn so much, don't we?
Yes.
Thanks again, everybody.